Welcome back. Before we continue our discussion on meningitis, let's take Emmy on the line from Joburg. Emmy, welcome to Health Talk.
Thank you. Hello. Good morning. Good morning, doctors.
Good morning.
I want to know, as a layperson, of course, virus and bacterial. The one, is it infectious to another person? Bacterial, do you pick it up? I mean, I don't know how it works. And if I find a rash, for instance, on my child, how would I know it's chickenpox and it's not meningitis?
Okay, excellent questions. Amy, we're going to show some small clip, and when we come back, we're going to, get the experts to respond to your questions, all right? All right, now, folks, 23 states in Nigeria are currently battling an outbreak of meningitis, with 8,054 suspected cases so far confirmed by the Nigerian Center for Disease Control. Now, one of the keys to curing meningitis is prompt treatment to save lives, and this you're going to hear more about shortly. Take a look at this.
An outbreak of meningitis has hit Nigeria. According to the Nigeria Center for Disease Control, meningitis has killed as many as 745 people in previous weeks. It's not the first time Africa's most overcrowded country has been affected by such an outbreak. More than 2,000 people in Nigeria died from the disease in 2009. Aid agencies such as MSF, also known as Doctors Without Borders, are doing all they can to stop people from catching the disease. James Kambaki, who's a nurse by profession and has worked on the field across sub-Saharan Africa, explains to us the work that MSF does when there are such outbreaks.
One of our biggest principles, we say, is to save lives and elevate suffering in that particular situation. So we're looking at really saving lives as quick as possible. So we set up hospitals, or we support the Ministry of Health facility that deals with that. So sending in personnel, doctors, nurses, to actually help taking care of those patients, saving the lives of those patients, using the drugs that we are going to also support and provide.
According to the World Health Organization, even when the disease is diagnosed early and adequate treatment begins, 5 to 10% of patients die typically within 24 to 48 hours of the onset symptoms. James explains why.
I think it's also in that context, the meningitis belt from Western Africa to East Africa is very difficult terrain in terms of logistics, in terms of organizing diagnostics, in terms of actually before confirmation is made, possibly several patients have actually died because it's difficult to reach those places.
Doctors Without Borders is a humanitarian organization that looks to help people worldwide where the need is greatest, delivering emergency medical aid to people affected by disasters or exclusion from healthcare.
In Southern Africa, we're lucky that we are not in that meningitis belt where these outbreaks. So what South Africans could do is to contribute to these organizations that help out, like Doctors Without Borders, not only in funding but also in personnel. So we'd like more doctors to come work with us and support us in meningitis vaccination and meningitis case management, nurses as well, to come forth and support during this time.
Meningitis occurs throughout the world, but the majority of infections and deaths are in Africa, particularly across the meningitis belt. This disease is potentially fatal and should always be viewed as a medical emergency.
A potentially fatal disease. And now we're going to hear more about this. I still have my three guests, Prof. Nilesh Govender, Prof. Anne van Godbeck, and Prof. Peter Cooper. Now, earlier on, we had a caller that asked a question around, how the disease is transmitted. And this is quite relevant because we've just shown a clip of the outbreak and also about, the rash. Perhaps let's just, before we start our discussion, let's respond to Amy's questions.
So specifically, she asked about viral meningitis versus bacterial meningitis.
Right.
And to answer her question, both of them are germs and both of them are transmitted from person to person.
Right.
different bacteria and different viruses have some differences in how they are transmitted. But generally, one can say that for the bacteria, for most of the bacteria, it'll be respiratory. And so it's coughing, it's for meningococcal meningitis, it might even be kissing, sharing, eating utensils. So it's the respiratory droplets. You need to have close contact.
Yeah.
But they say that
so
washing...
what is close contact? I mean, could it be, if we're sitting in this room, for instance, somebody has early meningitis, is not sick yet, you know, I suppose not picked up yet, and this person sneezes, can I catch meningitis?
It's not likely for some of the bacteria. For viral meningoencephalitis or meningitis, potentially, and interestingly, that is the one that is more self-limiting and doesn't require treatment. Even though it's a severe disease, it's, the prognosis is not so bad. So to answer, those are the differences between some of these meningitis causes. Even in a bacterial meningitis, some of them are caused by foodborne contact. So Listeria meningitis, another bacterium, will not be from respiratory spread, but from what one might eat. So I think I'd like the listeners and Amy to understand that the different organisms are transmitted in different ways. Generally, yes, sneezing and coughing, we should be doing that into our shoulders, into our elbows, so that it doesn't spread, because there are other infections that could spread that way. And we should be washing our hands, and especially if one's sick, one should be careful not to spread what one coughs or secretions and saliva.
Okay. I want to come back to you about the outbreaks and the factors that promote transmission just now. But before that, Prof. Cooper, Amy mentioned the rash. How will you know that, you know, this rash is chicken pox, it is not meningitis, you know?
Well, I think firstly, it's important, and I think Anne mentioned it earlier, that there's only one of the bacterial causes of meningitis that may or may not be associated with a rash. Viral infections often present with what we call a non-specific rash, but the meningococcal rash is a very specific one. It starts off as what we call little pinpoint areas, which look like bleeding, and then it spreads very rapidly. So you'll see new ones developing, often over, sometimes even over minutes, but certainly over hours. And then as it advances, it starts to look more like a hemorrhage under the skin. And so that's a very rapidly advancing rash, developing, as I said, sometimes even over minutes, but certainly over hours. And if a parent were to see that, that's an absolute emergency, to get to a hospital as soon as possible. But most of the rashes don't present like that. They may develop, a chickenpox rash develops over a couple of days, for example. So
perhaps the message then is, if in doubt, because I would imagine it's going to be difficult for a parent to know that this is the rash that I must worry about. Rather, take your child to a doctor.
If in doubt, get a professional opinion.
Yes. So look, they're showing on the insert the glass test, which is a test which you can do when you press against the skin, the rash, and it doesn't blanch. If it's a bleed, the blood and that rash will stay there. And in the UK and other countries, they've advocated for parents to use that sometimes. But I agree with you. Trust your instincts. If any doubt, go to a doctor or a nurse and have your child, whoever you're looking after, seen to.
All right. Let's talk about the impact. You may want to comment on these issues. You feel free to do so. But let's talk about the impact that meningitis can have, both on the sufferer and all around, you know, the family concerned, the health systems in general, and so on. Prof. Commander?
Thanks, Elis. I really think that we need to contrast adults and children again. The common causes of meningitis among adult patients is fungal or bacterial, sometimes viral, but the big differentiator is that the onset is much slower. So there's a subacute or chronic meningitis. And also, importantly, with fungal meningitis, there's no transmission from person to person. So if you're in the same room as someone with a fungal meningitis, that's not how you would get it. Everyone is exposed to this particular fungus, and it reactivates when your immune system is weak. In terms of impact, certainly cryptococcal meningitis causes numerous deaths. Up to a third of patients who are admitted to hospital will die, and thousands of deaths occur every year as a result of this type of meningitis.
Is it because of the difficulty to treat it? What are the factors?
it's a combination of difficulty with treating it. It often requires very long-term treatment, but also the fact that patients tend to present quite late. So when you have, when you've already lost consciousness and you've arrived at hospital, the chances of survival decrease dramatically as a result of the advanced disease that's already occurred.
Right. Earlier we spoke about, obviously we showed that clip on the outbreak of meningitis in Nigeria. And people watching this might wonder, oh, what are the chances that, you know, that outbreak will affect South Africa, for instance?
So that outbreak is in what is currently known as the meningitis belt in Africa, and it's got hyperendemic disease where, and what that means is that there's high rates of disease, it's ongoing, and then they have their seasonal increases, and at the moment they're busy detecting their seasonal increase. In South Africa we also have meningococcal disease, and it's endemic, so it occurs in South Africa all the time as well, and our seasonal increase is coming in the next 2 or 3 months, where we will see an increase in meningococcal cases, and most, if not all of those, will be from endemic, from strains that currently circulate in South Africa. It's very unlikely that there will be any outbreaks or clusters of cases as a result of importation.
Okay. I believe we have another call on the line. Is it Judy or Dudu? Dudu from Devon. Dudu, welcome to Health Talk.
Hello.
Yes, your question or comment, please.
My question is about the same disease we're talking about. My grandson is 11 years, and he's started complaining about the headache every morning when he's starting to go to school. I can't calm him because he said it's paining, even outside the flesh in the scalp is paining. I don't know whether it's a meningitis because I took him to the doctor, and the doctor just gave me a box of medicine, that's all.
Okay.
And I don't know what to do to know whether it's a disease.
All right. Thanks, Dudu, for your question. Let's get the experts to respond. Prof. Cooper?
You know, meningitis is a very rapidly developing disease. If this has been going on, and it sounded like it had been going on for at least perhaps a week or two, and perhaps longer, that's not meningitis. She'd have to look for another cause for the headaches.
So I suppose she needs to go back. If the child is not getting better.
As I said earlier, it's associated with fever,
right.
And inability to look at bright lights and so on. So this doesn't sound at all like meningitis.
Yeah, yeah. All right. Just before we go on a break, quickly about the factors that promote transmission on a wider scale. Your comment on that, please.
So in fact, interestingly enough, the high disease rates in the African meningitis belt, they're not fully understood. And this is specifically for meningococcal meningitis and meningococcal disease. But it's thought that some of the dry air, the sand in that sub-Saharan belt might have something for promoting the invasion of these organisms that are normally found in the nasopharynx. I think in winter and the seasonal increases, some of it is the clustering of people, the closeness, and so that type of spread of respiratory secretions is just enhanced during the winter period. But it also differs in South Africa, where in the Western Cape it's slightly different because the climates are different. And then for the other causes of meningitis, the foodborne, it's going to be the exposure, and that might result in an outbreak where they're all eating the same cheese that had listeria, or some other causes where the the viral meningoencephalitis, for example, is also seasonal, but sometimes more in the summer. And it's thought to be because there's a bit of another mode of spread of fecal oral. So interestingly, again, what could promote it will depend on the pathogen, on the organism, the germ that is causing that meningitis.
But people would need to be close together for that to happen.
For most of the causes, there would need to be some close contact, and it's not enough to be sitting and having someone sneeze in the distance. No.
Yeah, I suppose the important question to answer then is, knowing all what we know, what can we do to prevent? But that will take after the break. Now, after the break, we talk prevention. Please stay with us.
It is 6 p.m. Central African Time, broadcasting live from Johannesburg. This is Primetime News.
South Africa said farewell to one of the Rivonia trialists, Uncle Kathy, a fearless stalwart.
With this man who was so engaged, so busy, so witty, so funny, so wise, and